I'm Mike Gillard, President of PSW, and I'm happy to welcome you to our first full virtual annual meeting ever. I've had the privilege of serving PSW this past year, and of course, what an amazing, incredible, tragic, everything year. But before we get started, I want to provide a little overview of the features that you have access to during the meetings with the Zoom technology. This Zoom webinar is slightly different than a Zoom meeting that you've ever had. And there's also some features within the virtual event platform that you can access on a computer or tablet if you log into PSW's website and get into that way, or the conference app itself off of a phone. Throughout the morning, we encourage you to chat with colleagues, either direct messaging in the virtual platform or in the app, or even in the Zoom webinar chat box. You can do that privately, but just be careful. You can actually send a message to the whole conference attendee list if you're not careful. The Zoom webinar also has a Q&A box accessible from the bottom of your screen. This will be the method we'll use to field any questions if time allows at the end. So if you'd like to ask a question during or after, please use that Q&A button, and we'll try to address any questions as soon as we can. Today and tomorrow, and throughout your time reviewing all of the on-demand conference content, we hope you take some time for reflection on how your practice has evolved. In the past 10 years, in the past 5 years, in the past year, excuse me, and especially in the past 6 months. PSW is taking some time to reflect too, and I'm looking forward to using this time this morning with you to provide with you a PSW update that includes some reflection and looking forward. We conduct this member briefing at the educational conference and the annual meeting each year to highlight some of the important activities to all of its members. As I begin today, despite the immense economic and public health challenges and the civil unrest our world has experienced in the past 6 months, I'm pleased to report that PSW and the Wisconsin pharmacy family is strong. Transitions are a powerful opportunity to strengthen nonprofit organizations. They can serve as pivotal moments, enabling an organization to change direction, maintain momentum, build or rebuild its infrastructure, and clarify its mission and vision. And certainly you may have heard that not all nonprofit organizations in this country or the world are doing well. PSW is certainly in a great spot. It's with great pride that we announced in May that after the conclusion of a nationwide search, the PSW Board of Directors has named Sarah Sorum as PSW Executive Vice President and CEO. Sarah began serving as the interim CEO last year after past PSW CEO Chris Decker passed away following an inspiring journey with living with glioblastoma brain cancer. Dr. Sorum is a graduate of the University of Wisconsin-Madison School of Pharmacy and completed a PGY1 residency in community care through the University of Iowa. Sarah joined the PSW staff in 2007, and throughout that time, she's taken on expanded management and operational roles. We are confident that Sarah's experience and enthusiasm will successfully guide PSW into the future. We're excited to work closely with Sarah to advance the profession of pharmacy as a united organization committed to our culture of one voice and one vision. At this time, I'd like to provide Sarah with an opportunity to share some remarks with the membership. Sarah, please.
Good morning, everyone. Good morning and greetings from the PSW office in Madison. I'm the only one here today, but it is so nice to be with all of you online. I want to showcase this amazing team that's on your screen right now. This is our PSW staff team, and while I'm front and center on video right now, this is the group that really makes this conference and our work happen with the leadership of all of our amazing volunteers. So a special thanks to our PSW staff team. They're all joining from their homes today, near and far. We have a couple of staff members joining in with new babies at home, and A pretty exciting time for our staff, and we have a great team. We also have a couple of student interns that have been essential in putting together our programming that aren't featured on this picture, but we'll give a shout out to them at other points in the conference. I wanted to begin this morning with just a few remarks around being bold, being authentic, and being empathetic. This is a time of great challenge for so many of us. And we're really in a time of crisis in a lot of ways. At the beginning of the pandemic, the magazine Forbes published a commentary entitled, "Do People Feel You Genuinely Care? Why Empathy is Crucial to Leading Through Crisis." I would like you to reflect a little bit this morning and think about how many of us have felt fear, overwhelm, grief, isolation, confusion, sadness, anger, anxiety, and many other emotions during this time. I know I have. All of those emotions, maybe some more than others. The author of the commentary in Forbes says, her name's Margie Warrell, she says, "Emotional management is simultaneously one of the greatest challenges and opportunities for leaders at all levels in the midst of a crisis. I believe that to be true." She goes on to say, "Empathetic leaders feel genuine concern for others and are intrinsically motivated to help them thrive." In her description of an empathetic leader, I hear PSW described. We want PSW to be an organization that shows genuine concern for our patients and for our pharmacy professionals that serve them. We want PSW to be an organization that is driven to improve the care of patients. And we want PSW to be an organization that is driven to help pharmacy professionals thrive. During this time of global pandemic, this time of crisis and racial inequality, this time of economic crisis, it's caring for those patients that connects us. We want to care for those that serve them. And while all of these emotions that I described earlier are present, being present for our members and our patients shows that we care all of the time. While we express this empathy, we can be bold in challenging the status quo. The expression of empathy doesn't make us soft or emotional. It makes us strong and steadying. It supports our ability to get hard work done and lift others together as we move forward. So I used to be more of a morning person, and I'm not a morning person right now anyway. So I wasn't up to see the sunrise this morning. So this picture of sunflowers is about as good as I can do. But yesterday was a strong day for PSW, and tomorrow is even brighter. And I know that better days lay ahead. I'm positive of it. We need to think about what we want pharmacy practice to be like on the other side of the pandemic. We also need to think about what opportunities exist for pharmacy professionals to impact systemic racism in their communities and in our healthcare system. I'm so optimistic about what our great people in this profession will do together to support patients in their communities. I have the opportunity to meet with my counterparts across the country and my counterparts for other associations in Wisconsin. These are folks from all different types of association backgrounds, not just healthcare. And I really get inspired by the work that they're doing to serve their members. During a recent conversation with one of these counterparts, he said to me, "Never lose sight of who you are as a leader. You need to be you." And I believe that to be true. I believe that leading with authenticity and empathy is important. I learned a long time ago that the most powerful question you can ask someone you work with is, "What do you think?" And we're going to be asking our members and our patients, what do you think? What do you need from the practice of pharmacy? We develop our skills and empathy through listening. PSW is listening to our members, and we are ready to help you thrive through bold innovation and connection with one another. So those are the remarks I wanted to make this morning. And at this time, I'd like to hand it back to Mike for a great review of some of our current activities and what lies ahead.
Thanks so much, Sarah. So in the past 10 years, PSW has become extremely effective in bringing members from all practice settings together to advance our collective goals of improving patient care through advanced pharmacist-provided services. In the past 5 years, PSW is engaged in furthering critical public health initiatives and lifting up important workforce conversations, including how technicians are leveraged. In the past year, PSW has worked to build an infrastructure that will provide strong footing for the future. And in the past 6 months, PSW has demonstrated how essential it is for the essential workers to have an advocate and value-added information they can trust. Advocacy plays a central role in our work to improve patient care. This past year, PSW members have played an important grassroots role in advancing priorities. The most common requested policy solution from our members is the need for common sense, comprehensive PBM reform or pharmacy benefit manager reform. Legislation to this effect was a key priority for PSW this past legislative session. The bill would not only register and regulate PBMs here in Wisconsin, but it would provide greater transparency for patients and pharmacies and prohibit many of the practices that some PBMs have used to restrict access and reimbursement. Hours-long hearings, petitions, social media campaigns, a record-breaking legislative day all showcased how our members can really bring issues to the forefront. For those that engaged in these conversations and for those who cheered your colleagues on from your practice sites, thank you so much for your engagement. We had a tremendous legislative year this past February. Unfortunately, because the legislative session ended early due to the COVID-19, legislation that would regulate PBMs in Wisconsin has been put on hold at this time. PSW is continuing to advocate for comprehensive PBM reform with legislative leaders and to evaluate options moving forward for the bill's passage. Before the legislative's recess, the bill had passed the state assembly unanimously and was waiting state Senate passage. So I'm confident that this thing is gonna get across the goal line here. As we look forward to the 2021 legislative session, PSW has a number of key priorities that keep patients at the center of all we do. Promoting transparency and accountability through PBM reform, increasing access to pharmacist-provided services through provider status, increasing access to medications through independent prescriptive authority for contraceptives, ensuring pharmacists are able to provide COVID-19 vaccines when they become available, and promoting technician work ladders by creating a technician registration program. Even in these divisive political times, we are keeping patients at the center of our policy priorities. Now, after a long several-year deliberation, the Pharmacy Examining Board has updated Phar 7. And this is an attempt to bring it up to current pharmacy practice standards. And so it's a very comprehensive review. The version will go into effect January 1st of 2021. You can download it off I think there's a link in the PSW website, as well as there was a link in FastFacts this past Friday. So please take a look at that. But if you don't, there's also a new toolkit that PSW members can look at that will highlight the changes that are in Phar 7. So that all pharmacists and pharmacy technicians and pharmacies should be aware of. This toolkit is now available and can be purchased on the PSW website. Additionally, there's an on-demand CE program available that walks through the major changes. The program is part of the virtual annual meeting, and it's also available as a standalone program. So I encourage you to take advantage of that. At PSW, we believe that every patient needs a pharmacist. And I would say that every pharmacy professional needs an advocate. PSW serves as that advocate for pharmacists, pharmacy technicians, and student pharmacists. As Sarah recently said in one of her blog posts, and if you're not following her on the blog, Twitter or LinkedIn or wherever, I suggest you do. If it's right for the patient, then it's right for the profession. PSW works to bring pharmacy professionals together to make a difference in patient lives. It's been said that the secret of change is to focus all of your energy not on fighting the old, but on building the new. PSW, we're working together, volunteers, staff, and collaborators, to focus our energy on building on the new. I'd like to take a few moments to provide a brief update on some of our innovative work which aims to create value for PSW members and patients through practice advancement and education. As you can see from the graph, Wisconsin is very under-immunized and is outside the top 20 states for nearly all vaccines. So it's easy to say that we've got some work that we can do. Low vaccine rates have only been exacerbated by the COVID-19 pandemic. Upon the increase in the pandemic in March, vaccine rates immediately dropped and have remained below the 5-year average. Every age group has been affected. If nothing changes, this could have an effect on herd immunity and lead to outbreaks of vaccine preventable diseases. The PSW website is currently under updating, so you'll see a lot of different ways that we can improve our vaccine rate and immunizations. So there's a lot of resources available that you can find. There's certainly opportunities that you can see from the statistics that Wisconsin pharmacies administer almost 70% of zoster and 20% of the influenza vaccines. But there's certainly plenty of opportunity for other vaccines to be administered. When surveyed, the pharmacists' top barriers to vaccinations were patients were just refusing for financial reasons, having insurance coverage for vaccines or lack thereof, and other responsibilities taking precedence over getting vaccinated. A great published journal article in the Journal of Vaccines talks about our review of our Wisconsin pharmacy immunization rates. One of our other innovative projects is to assess the impact of a health system's clinical decision support tool on naloxone prescriptions. If successful, this tool will be implemented nationally. Preliminary data suggests that naloxone provisioning was increasing, but dropped at the start of the pandemic. The levels have since increased, and we continue to document the effect of the clinical decision support tool. PSW is facilitating brief academic detailing sessions to increase naloxone prescribing. Faculty members from all 3 schools of pharmacy have been trained in academic detailing and taught students on how to talk about naloxone on their rotations. If one of your APPE students asks if they can talk to you about naloxone for a few minutes, give them a chance. They have some great information to share. PSW members, staff, and collaborators are leading practice and patient improvement projects in all corners of Wisconsin. In particular, PSW has ramped up our support of re-engineering pharmacy practices in the community setting by partnering formally with CPESN, Wisconsin, a growing network of pharmacies participating in the care of Medicaid patients throughout the Wisconsin Pharmacy Quality Collaborative. Payer partnerships and public health partnerships are growing with pay-for-service programs and pay-for-performance projects. PSW is driving practice forward by supporting our members' innovative work. PSW has added new resources intended to support both service delivery and reimbursement for pharmacists. In the new post-COVID world, telehealth services have grown exponentially. PSW has developed resources for pharmacy services to be provided via telehealth. Not only are more services being provided, but pharmacists and patients have been 100% satisfied with the shift as well. That's the sign of a changing time that we are entering. The PSW-led Community Comprehensive Medication Review Program is held in Dane County. Pharmacists are focusing on identification and resolution of medication therapy problems. While it's been a proven success in Dane County, PSW has expanded our work on this program to other areas of the state and other payers. PSW is starting year 3 of 5, working to incorporate the Wisconsin Medicaid MTM program into the Wisconsin Division of Public Health priority areas across the state, including Brown, Eau Claire, Oneida, and Rock counties, and in partnership with a federally qualified health center at the Medical College of Wisconsin. While sometimes innovation pops up as a pilot for one area of the state, only a few pharmacies or a small network, PSW efforts are targeted and aligned with the state and community partners, and we are rolling out programs statewide. Cumulatively, our initiatives support and advance pharmacy practice. Now, all this innovation takes leadership, and PSW recently launched 3 new leadership development courses: Leadership 101, Essential Skills for Leaders, and Expanding Your Leadership Toolbox. You can find all 3 of these courses on PSW's online CE page. And backed by popular demand, PSW is once again hosting the Emerging Leaders Certificate Program. Sign-up will be announced in Fast Facts in late fall. Technician membership in PSW has doubled in the past few years. As I mentioned earlier in the slides, advocacy around technician and career advancement is vital. In addition to this advocacy, PSW is working on crafting important technician education. We have a package of webinars just for technicians covering pharmacy calculations, customer service, health literacy, and an overview of USP. This can be found on the PSW online page. We know that members are hungry to tap into engagement opportunities. We want to make it easier to plug in, and I encourage you to check out the Get Involved page on the website and watch for more information in the coming months via Fast Facts. I'm serving on a newly formed PSW Member Engagement Committee, which is a subcommittee of the Board of Directors, and we're working on transparent and meaningful opportunities for excited members to give of their time and talent. We now have the opportunity to intentionally extend our culture of collaboration and mutual respect to talk about diversity and inclusion. We recognize that greater participation by diverse contributors can solve problems more creatively and identify growth opportunities that the association might otherwise miss. With the leadership of the newly formed PSW Diversity, Equity, and Inclusion team, the Board of Directors is clear that our diversity and inclusion work will be an important aspect of our one voice and one vision for the future. And my last update for this morning, I wanted to share that the PSW is excited to launch a new website, which is targeted for January 2021. The website will feature a refreshed, reorganized, and updated content. It'll have a more modern look with new graphics, colors, and navigation menus. And it hopefully will be a more mobile-friendly website with opportunities for integration with our conference app. This is certainly our first adventure today with our annual meeting, having a web-based platform in addition to the conference app that is on an iPhone. So I'm thinking in conjunction, this is actually going to be a great opportunity to see how well this works. The staff is working closely with the PSW website committee to determine what stays and what goes. So if you have suggestions, please send an email to one of our board members so we can pass that along. We're evaluating every suggestion to organize and streamline the content across the practice sites. As we look into the future, you are an important part of our organization and our profession's success to advance the care we provide to patients. Your innovation and willingness to explore new emerging roles and drive policy and education that supports these new roles is critical to our future successes. We are excited to support our members in their practice sites, championing the care they provide. Thank you for your time this morning, and thank you for all you do for your patients and our profession. At this time, we'll take a short break to transition to our next keynote session of the morning. You may stay tuned, stay muted, and visit with colleagues in the chat or in the direct messaging feature in the virtual platform of the app while we set up our next session. Thank you so much.